Migraine is the second leading cause of disability worldwide. Some estimates suggest that there are more than 60 million migraine patients in the US alone. Oftentimes, people think of migraine as head pain, but patients who have migraine, they experience several other symptoms that at times can actually be more bothersome than the pain. And some of these symptoms can actually start several hours, up to even 2 or 3 days before the pain part comes.
My name's Meridith. I have been suffering from chronic migraine for more than 15 years. When I was 16, I was in a really difficult car accident as a passenger, and since then I have been trying to figure out ways to manage chronic migraine and what has become a lifelong illness to manage 24/7. On average, I was having 2 overnight hospital stays per year as a result of a migraine that had lasted for more than 24 hours. And so very often for me, those migraines were not in fact just a neck ache and a headache. With that came extreme nausea, often severe dehydration, and many of my friends and family have had to transport me unconscious to the hospital as a result of some of those migraines taking their toll on my body. And so 8 years ago, when I moved to Morgantown, I started to see Dr. Umer Najib. And he has been my neurologist since then.
I've been fortunate to be involved in Meridith's care for several years now. Meridith is a great example of a complex migraine patient who did not respond to several therapies individually, but responded well to combination of therapies.
I take 3 preventative medications. I started to get Botox for migraine, and I started utilizing triptans as an abortive medication to treat migraine. I have tried any new medication and all of the trendy pillows and ice packs and diets. I have had a long history of trying all of those things, and luckily now in my 30s I've reached a point where I'm in such good care with my team of physicians that I feel much better waking up every day knowing that chronic migraine is managed. You know, my husband and I really love to take road trips, and we really love to travel. A couple years ago we finished visiting all 50 states, and believe it or not, managing migraines through the journey to all 50 states was one of the harder parts when considering that journey. It was harder to manage migraines on that journey than it was to actually get to all 50 states. My friends and family often they think about it more than I do because they are concerned that I'm experiencing pain 24/7, and sometimes that can be the case, but more often than not, I'm doing types of planning and maneuvering of my schedule to try to make things easier in the future so that I can be spontaneous or feel prepared on a trip or just be fully present at certain events. And I'm really grateful to be able to do that, even still with 28 migraine days a month.
If a patient starts to experience headaches that raises the question of migraine, they should seek medical help. So even if someone is experiencing rare attacks, they should talk to their healthcare provider and discuss the treatment options.